Prior to contracting COVID-19 3 weeks ago, Director General of the Guyana Civil Aviation Authority, Lieutenant Colonel retired Egbert Field, was your average healthy man. As a matter of fact, he exercised daily, went for walks in the park, and he set up a mini gym at his house. Mr. Field decided to get tested on September 20th after one of his employees at the Civil Aviation Authority tested positive. On September 24th, his symptoms took a turn for the worse. Mr. Field collapsed and had to be rushed to the Infectious Diseases Hospital at Liliendal, Greater Georgetown, where he was immediately placed on oxygen and medication.
The next thing I knew, I was in the hospital. They told me that I walked to the ambulance. I can't remember even that. But I ended up in the hospital, and that evening, I really didn't know where I was. I couldn't differentiate between ceiling and wall. I don't know if I was in a state of being delirious or what, but nothing made any sense.
Mr. Field received his first dose of the AstraZeneca COVID-19 vaccine in April this year and got his second shot a month later. As the former military officer described it, the vaccine helped his body to develop little soldiers to fight off the virus.
What I want to say, though, is this virus hit me with such a punch that I went under. I don't believe I would have been able to bounce back up if I did not have the vaccination. I strongly believe that having had the vaccination fully covered with it, that is what helped me to come back up and to come back as quickly as I am coming back.
He is urging everyone to get vaccinated against this dreaded virus so that they can stand a chance if they ever contract the virus. Mr. Field spent 5 days at the COVID hospital. He said the doctors and nurses there treated him with compassion and care, and this, he explained, helped in nurturing him back to health.
I strongly believe what they did for me, that helped me to pull through. My meals were on time, even though I didn't have an appetite, but I knew if I had to get well, I had to eat. So my meals were on time. If I needed, after dinner, on some occasions, I needed a cup of tea, or if I needed 2 cups of Complan, I asked, can I have some hot tea? And it was there.
Mr. Field recounted that one night he could not sleep because he was afraid he would not wake up in the morning.
One night while I was in the hospital, I may add, I did not sleep because, 1 or 2 times you see a gurney pass wrapped up in plastic, it's a body, and you can hear some of the shouts from some of the patients in there. I guess the pains that they were feeling. So one night I didn't even sleep because I was afraid that I wouldn't wake up the next morning. But thanks to the Almighty, thanks to God, that I was able to recover, and I don't wish this on anybody.
Mr. Field also thanked the family and friends who prayed for his recovery. His daughter, who is a doctor at the University of the West Indies Hospital in Jamaica, flew in to care for him. Meanwhile, as of October 11th, Guyana has recorded a total of 842 COVID-19 deaths since March 2020, while 33,748 persons have tested positive for the virus. September 2021 is recorded as the deadliest month yet, with a total of 179 deaths. Reporting for the newsroom, I am Isanella Patwo.